Let's talk about the third wave and vaccinations for children, shall we? I have with me MD, DNB, MNAMS, Triple FRCP, Dr. Manohar KN. He's consultant physician and diabetologist with Manipal Hospital. Thanks for your time, doctor. How's it going?
Oh, it's far better. Even actually, the second wave was even tougher, honestly speaking. With respect to the number of cases, problems with oxygenation, beds, and so on. But only thing is a bit of an experience from the first wave. More importantly, being vaccinated.
So, doctor, what's the scene? Is there any way we can escape the third wave? Could it be just a myth? Is it all just a bad dream?
As much as I hope it doesn't happen, but in all probability, and if you look at how these pandemics behave, it's more likely to have a third wave and many more waves, honestly. But again, what determines these waves are three factors: agent, host, and environment.
In the US and Israel, data shows that young adults and children have been most affected during the third wave. So, what is likely to impact on child mortality in third wave?
Well, that's what it is tries to attack the weakest link. The elderly and the adults are being partially at least protected by the vaccination. So we presume or we think possibly younger people are at risk this time, which is true, which is already shown in the US and in the Israel. But one good thing we should always remember is most of these viral illness are self-limiting amongst children, and the risk of getting into complications is 5 to 6 times lesser in children as compared to the older adults. What I am worried about is two things. One is children may have less symptoms, less complications, but then they are difficult to isolate, and then they may knowingly, unknowingly affect their own close proximity adults, maybe parents or grandparents, and so on. So again, that will increase the case number. Secondly, we already saw in the second wave, there was a hue and cry for oxygen, beds, and so on. Adults, somehow it is more easier to manage, but if I hope that we don't see this situation, but if children get into like the number of cases skyrockets, we don't know how well equipped we are with respect to managing these kids in the ICUs, beds, even the normal bed, ICU bed, ventilators, oxygen, ambulance, etc. Because it is a bit of a different type of a challenge to consider.
Yeah, pediatric care comes a department,
Yes.
a different department altogether. Doctor, we've been hearing about vaccination for children while there's been plenty of contemplation of whether schools should open and things like that. Are there any vaccines for children in India?
Good news is amongst the vaccines available, Zydus vaccine is recently been approved. They had done a study in about 1,000 children. And another interesting thing about the Zydus vaccine, two things. One is it is a DNA-based vaccine. So far, we already in the market have more of an RNA-based vaccines. This is a DNA-based vaccine. Secondly, it doesn't have any needle. It is inoculated through a stream, jet stream. This technology, we use it in another injectable forms in diabetes management also. So these are the two highlights of it. Secondly, the good old Covaxin from Bharat Biotech is also almost completing the trial data. Hopefully, they are submitting into DCGI shortly. Apart from that, there are some mRNA vaccines by Genova Pharma and Novavax vaccine, which are in the fray. But I think the first one or two to be approved, especially in Indian context, would be the Zydus one and the Covaxin one. We are looking forward for it. Again, there is a bit of a controversy. When we speed track, people have doubts. That's why DCGI is taking time to analyze the data and then go ahead. Hopefully, by the end of this year or early next year, we should start vaccinating them.
There are around 40 crore young persons below 18 years to be vaccinated in our country. And of course, COVID vaccination among children will start only once all adults are vaccinated. So we better get ourselves vaccinated as soon as possible. Also, we've been hearing about a booster dose. I think this came after the Sriram Institute of India's chairman mentioned that he took a booster dose 6 months after the second dose. Is that a must-have?
Yeah, very important, interesting, and honestly intriguing question now. There are certain vaccines which we can be given only once in your lifetime and you can be done with it. but there are certain vaccines which you need to have a second dose. Few vaccines like the influenza vaccine, we take it annually. So now I'm a part of one study called the COVAT study, where we are assessing the antibody levels towards the vaccinations in doctors because we were the first to get it. And we honestly are seeing a dip in the antibody titers after few months of vaccination. And also there is a lot of data coming from the Britain that possibly we need a booster dose because the antibody titers are dropping. So two things here. One is there are some people who don't mount antibodies. Aren't they protected? Is the question. There are two types of immunity which develop. One is called cell mediated immunity, the other is antibody mediated immunity. Cell mediated immunity we can't measure. So we end up measuring what is measurable, the antibody mediated immunity. So there is definitely drop in the antibody levels after 6 to 8 months, which we have seen, but there is no increase in breakthrough infection. So the question is very difficult to answer as of now, but there is a lot of research going on. Hope we'll come up with a definite answer. But there are people who suggest possibly, at least for the healthcare people, provide a booster dose and study them whether the risk of infection comes down, and then only we can utilize the data and spread it across to the whole country or the globe. Because we can't try it. See, vaccination is easy to talk. Why don't you give booster dose? But again, there is a lot of things to be in consideration at the government level to do this. So mostly required. We'll wait for a definite answer shortly.
He's a consultant physician at Manipal Hospital, MD, DNB, MNAMS, Triple FRCP. He's the medical director at Disha India Foundation as well. Dr. Manohar KN is on the show. It's been quite an interesting conversation where we spoke about vaccines for children, the third wave, and what is the likely impact on child mortality in the third wave.
The superhero show, superhero show. Viva 104, turn up the radio.
Doctor, before we wrap this up, I want to ask you, what can be done to decrease the impact of the third wave? What are the steps to follow?
I'm sure we have bored everyone by talking the same again and again, but how much ever we emphasize or re-emphasize, it is less. In the sense, people are fed up, honestly speaking, isn't it? There is a burnout about hearing the same COVID appropriate behavior and vaccination. But unfortunately, there is nothing more than that. We need to keep ourselves healthy. If you have some chronic diseases like diabetes, hypertension, heart disease, keep our cancers, keep it under control. Otherwise, do your regular exercise, balanced diet, follow COVID appropriate behavior, whether you are vaccinated or not. I always akin vaccines to similar to seat belt or helmet. Just because you have it, you don't have to be rash. You still have to follow the traffic rules the same way. And then try and not to get infection. If you are having a suspect infection, please isolate yourself and so that it doesn't spread to others. This is the usual thing what we are saying. I know people are getting fed up, but there is no choice, and we are talking. It's a matter of not only life now, livelihood also, isn't it?